So we still have 1 minute. Okay. Okay, so I hope you guys have an excellent day today, whatever you were doing. Start getting cold now, getting colder and colder. Oh. Okay, so we are going to continue with the medical assistant profession. Any questions before we start? Anyone? Okay. So let's continue then with the medical assistant profession. We were left on we were talking about, remember, just a little recap, the clinical and the administrative tasks that a medical assistant needs to accomplish when certified, clinical and administrative. So we were talking about the administrative part. Once again, this is what is this part of the module all about. But we're going to mention the clinicals as well. It's just that this module is focusing mostly on the administrative part of the medical assistant. So we talk about these clinical duties because we talk about the administrative first. No, wait a minute. We covered all this, the clinical, the administrative. Okay. Yeah, we were here. So we were doing the clinical duties, remember? So we discussed medications. This state and many other states do not allow the medical assistants to administer medications. So that should be really clear for you. Remember, I explained you things that happens in the medical arena that people is gonna ask you, other coworkers, your doctor, a nurse, to do certain things for them. So if you are not, if it's that whatever they asking you is not part of your scope of duty, you should not do it, but you should know how to refuse. Remember, very politely, very professional. That's how we do it. Anytime someone asks me something, I said, sorry, unfortunately, as much as I want to do it, but my certificate, my program, whatever I study, whatever my profession is, does not allow me to do that. So that's basically what it is. I'm going to train you. Okay, you train me. That's fine. I'm not going to refuse you training me. But then you have to sign every single time that you are asking me or requesting me to do something. Remember, the only way that we can protect ourselves is, doesn't matter who's asking us to do something. Okay, I know how to do that. I'm not supposed to be doing it. But then sign me a paper that you are authorizing me to do that. After you've been saying that, that your scope of duty does not allow you to do those things, and they still keep on asking, says, well, as much as I want to do it, if you sign me a paper authorizing me to do the procedure, or you're willing to train me, and still you're going to sign, you have to have a document signed by someone that says, I am such and such person, and I'm authorizing you to do that. They will not go that way. Believe me, they're immediately gonna look for someone else. But what is the issue right here? That you don't wanna be the target of anyone in your workplace. You don't want someone to retaliate back to you because you refuse to do something. You know that happens pretty often. If you don't know how to handle the situation, if you don't know how to talk to people, they're going to retaliate on you. Remember, I know people that have been fired in the workplace just because of the way that they respond back to the person that is asking you something. Of course, you're not going to be fired on the spot. Oh, you're fired. No, it's not going to happen that way. But they're going to give you a little time and they're going to let you go. Next thing you know, particularly it happens on Fridays, because that's your last day at work. So that day, they're going to tell you, okay, we're not needing more of your services. We decide to let you go. And remember, you cannot ask why, because these contracts that we sign at jobs, this all has to do with this. The contract that you sign at your workplace is contract at will. That's what it's called. What does it mean at will? That they fire you whenever they wanted to fire you without giving you no explanations, reasons for the dismissal. They don't have to. But you also can resign whenever you feel like it. So be careful with all the things that you do and you said, because that can be used against you. So be very professional at all times. That's the most important thing. Being professional, being on time. Don't give no reasons to your boss, to someone else who is in charge, to write you up, to call your attention, to give you a suspension or anything like that, because now your job is on the line. So that's what's important here with these classes, is how to communicate, how to see the medical assisting profession. It's not just the things that you learn in school. No, it's how the real world is going to be presented to you and how you're going to be handling all these situations. That's the key. It's not like, oh, I have a certificate and I'm going to get a job. Yeah, but if you're going to do something that you were not supposed to be doing, you're going to get in trouble. And the problem is not that you're just going to get in trouble yourself. You're going to get in trouble the office, the hospital, the clinic, whatever place that you're working at. So for that reason, they want to get rid of you right away, because you are the one who's bringing problems to this particular facility. We don't want you like this. So be careful. It's not just learning, oh, I know, I might have to do that. Well, if they ask me to do it because it was the doctor, yeah, I'm going to do it. Oh, I feel like I'm a nurse now. I feel like I'm a doctor now. No, you don't have the certification. You do not have the qualifications to do certain jobs. You don't do it. It doesn't matter if you know how to do it. See, I have students that they've been doctors in their country. But remember, it's in their country. So that means not much in this country. So they start doing my programs. They take my classes, but they have all this knowledge. And they go there and they think that because they know all this stuff and because the doctor asked them to do these things, well, you're putting yourself at risk because you're not supposed to be doing certain things. But if something happens, the doctor is not going to stick for you. On the contrary, they're going to blame it on you, everything that have happened over there. They don't take responsibility. They want to blame it on you. So be careful. Being through all these things, I have seen so many things happening. Remember, once again, I started as a medical assistant. So it's very important for you to understand what is the scope of your duty and how to respond if somebody asks you to do something that is not within your scope of duty. That's basically what is important. Administrative duties. Remember, we have the clinical part. Now we have the administrative duties. So one of the things that we always forget is to greet our patients, being pleasant, welcoming whoever comes to our business. This is business for us. So every single time that someone shows up in the office, and if we are in the front desk or whatever side that we are in the office, we have to greet our patients. Not only the patients, the vendors, salespeople that comes to the office, contractors, family members. So we have to greet them, and we have to do it with professionalism. And in the same fashion, good morning, good afternoon, good evening, Mr., Mrs. How can I help you? How can I assist you? That's how you have to do it. And remember, you have to call them by their last name. If you don't know yet, if it is a new person, you are new there in the office, no problem. Good morning, Mr., Mrs. How can I assist you? How can I help you? Oh, I just come to see the doctor. Have you been here before? No, this is my first time. Okay. Can I have your name, please? Can I have your ID so I can see exactly who's the person? And you move from there. That is greeting your patients. That is welcoming them into your office. That creates a different environment. See, if I go to a place and I ask for help, I say, hi, good morning, good afternoon, excuse me, and they ignore me, I'm already upset. I'm here because I have a problem, probably a medical problem. Maybe I need a note from the doctor. Maybe I'm the first time in that office. I already feel rejected. That's how everybody feels. But if somebody says, oh, acknowledge me, even though if I'm busy, because we're going to talk about that, you have to acknowledge that I'm there. Hi, if I'm just getting close to the counter and you are on the phone, I know you're on the phone. I'm not going to attack you. But you, as a professional, you should excuse yourself, whoever you are on the phone, and greet me. Hi, sir, Mr., Mrs. I'll be right with you as soon as I get off from this line, okay? Talking to another patient. That's how we have supposed to do things. Not turn around and ignore me. I know you're busy, but that's not the way of, addressing your patients. So greetings, very important. Every single time. It doesn't matter if you know the patient, you've seen them before. Well, you have to greet them every single time that they come to your office, and in a very professional way. Remember, you do not greet your patients as, hi, honey, hello, hunk. Oh, cutie, what do you want today? This is not how you talk to your clients in a professional setting. All the time, being very professional. Ah, baby. Oh, no, I'm not your baby. I'm so sorry. I have a name. Remember, these are questions for exams. How to address your patients. All this is very, very important. You're gonna have to answer the phones. Of course, we're gonna talk about that when we get to that chapter. Answering the phones. But you have to talk to people the same way as when they come in person. It's the same. They're not seeing you, but they are hearing you, and they are hearing your tone of voice. and whether you call me or you ask me for my name or something. So it's no difference. It's just I'm not seeing you, but I'm hearing your voice. You have to update and file patients' medical records. So every single time that the patient comes in, after you greet them, after they tell you what they are for, hi, sir. Oh, you've been here before. Okay, sir. Has any information changed? Like your phone number still the same? Are you still living in the same address? Your email? Anything? We change things. Let's see. This year I have changed my phone number 3 times. So we change numbers. We change things. We move from addresses. I haven't moved from my place because, well, it's mine. I got it for a long time. So, but some people rent, some people sell the properties and move to another place. So we have to ask that. We have to keep the information up to date. Personal information. Sometimes, people get divorced, people got married, people change their last names. So we need to ask if there is any personal information has changed. So that is the correct way to gathering information from your patients and updating that information. You're going to be scheduling patients. We are going to be talking about that in one of the chapters. We're going to talk about all these types of scheduling formats. Not just that because it's computer or paper based. No, there are different types of schedules. So we will discuss that when we get there. Of course, you're going to be, introduced to computer applications over there because you're going to be using probably the computer applications for medical records, for scheduling appointments. So all that's very important to, instead of mailing or giving the patient a paper for the referral, you can do it electronically. So technology has evolved a lot. So you have to be, willing and, and ready to enter in this particular arena, which is computer applications. They're going to train you, of course. But if you know how to send messages from your phone, if you know how to Google, create an application, it's easier than that. Because over there, you don't have to create anything. You don't even have to create an account. They're going to create it for you. See the way that you're using this application for the class, Teams, is very similar. So just go there, enter your information, and now the whole information comes in a window, and you're going to say, okay, patients, financials, X-rays, blood, correspondence, history, medications, all that is going to be separated in folders, and you're going to be able to see it. And you just click and enter the site that you want to use. So don't get scared by, oh my God, what application are they using? It doesn't matter what application they're using. It's very simple. I'm telling you. It's very, very simple to deal with that. Somebody walk you through once, that's it. You're in. Billing and collections. Well, when we talk about billing and collections, you are not the person who's going to be collecting money, meaning sending letters to the patients who are late in payments. No, you're going to be collecting money in a different way. You're not going to be billing the patients either. Even though if it is a doctor's office, they have a billing account. That is not going to be you, the one who's dealing with that. Sometimes they don't have it within the office. They have an external billing company that does all these financials for the office. But this is a very, very serious and very detailed. But you are going to be collecting money like the copayment. See, if you have gone to your doctor and you have a medical insurance, some medical insurance, particularly commercial medical insurance, you have to pay a copay. Every single time that you go to the office, you have to pay. We're going to discuss that in more details when we get to insurance. But I'm just giving you a little taste of what administrative duties is all about. I'm just not going to read it and move on. Well, you can read it better than me. So that's not the point. The point is kind of going a little overview of every single item so you can have an idea what is exactly that you're going to be doing. So when you hear the word billing and coding, don't panic. That is not something that you're going to be doing. I'm telling you, 100%. When it comes to money, you have to get the people who really knows the stuff. So coding and billing, very complex tasks. So medical assistants are not required to do that. So just believe me, the only thing that you have to do with billing and coding is knowing about insurance. Verifying that the patient has insurance, that the insurance is active for that particular day that they receive the services. Those you have to do every single time the patient comes in. Hi, good morning, Mr. and Mrs. Smith. How can I assist you today? My name is Alberto. I'm the medical assistant. Oh, by the way, I need to see the doctor today. Sure. Do you have an appointment? No. Oh, let me see if we would have space. Okay, let me have you been here before? Oh, yeah, many times. Can I have your insurance, please? NID? And then you verify. What is the purpose of putting the patient to wait? And then you're going to be finding out that the patient has no insurance coverage. Remember, if the patient doesn't have insurance coverage and you register the patient and the patient sees the doctor, the patient has to pay the money. But now you're going to have problems because the patient is going to receive a bill for that particular visit, that amount of money that it has to pay for the visit and whatever the doctor ordered. And the patient is not going to pay it because they said, oh, when I came here, I have my insurance and I gave it to you. It's your responsibility if you didn't verify that I have coverage or not for that day. So don't assume that people have coverage every single time because just present a insurance card. No. This insurance card have an expiration date. Depends on the type of insurance that you have. You probably have some limitations for visits, procedures. So you gotta get familiar with all this. And I'm gonna talk about this because we're gonna have a class that is just for all these insurance, medical insurance and types of medical insurance. Just for you to give you a little overview right here, what you're supposed to be understanding right here. But I'm telling you from now, so don't panic that you will not be doing billing and coding. You will not be filing forms to collect money from the patients and send it to the insurance company. No, that's not what you're going to be doing. Procedures and diagnosis coding. Once again, this is the second part of billing and coding, or billing and collections is one thing. Procedures and diagnosis, this is the codes for procedures that are done in the office and the diagnosis. So you don't have to do that. So you don't have to deal with that. Or the doctor has already the codes for whatever they diagnose, but whenever they're gonna do, they're gonna file, they're gonna send a claim for services provided to the insurance company, someone else is gonna be in charge of that. So don't worry about that. Remember, when you talk about collections, meaning calling the patients and making sure that the patient pays whatever money they have supposed to, you don't have to deal with that. Ordering supplies, that's a different issue, but you will order supplies only if you work in a doctor's office and you are the only one over there, or you are, seasoned person, you've been working there for a while, now you are familiar with everything that is needed. So then you might be ordering supplies, like gloves, paper for the paper table, this paper that we roll on the table when the patient comes and they are examined. They're gonna order, you don't worry about tubes or anything about phlebotomy, because the lab for they get the services from, they bring all these supplies. But sometimes you have to tell them, hey, listen, can you get me some tubes, in what color tubes they need, and so on and so forth. So supplies is whatever is needed in the office. So you guys have to keep an inventory and see what is needed. So that's basically what it is. So that's part of the administrative duties. And remember, you have to be checking if you're in charge, because someone is in charge there of the supplies. So you have to be checking all the time. You're not gonna wait until the last minute when things are over, so then you can order. No, because that takes some time to receive them. And we are using these supplies continuously. So whatever is used the most, depends on the practice, you have to order it frequently. So you have to be on top of that. So that's basically what the administrative part is all about. There are more, of course. Any questions about this part of the administrative part, task that you might have to do? See, filing for insurance, you don't have to fill out those claims and send them to the insurance. No, this is not the job that medical assistants do. Back in the days, of course, see, once again, hospitals, never a medical assistant do this type of task in a hospital. Doctor's office, back in the days, they were using the medical assistants for this. Why? Because they didn't want to pay someone to do this job. But guess what? Because the medical assistants are not prepared, trained properly for this type of task, the medical doctors were losing money. They were not collecting the money from the patients. These forms, these claims were not completed correctly. So they decide that they're going to pay a professional, a company who is going to be doing the billing for them, filing for these payments. That's basically what it is. What you're going to be doing is taking telephone message. Oh, yeah. Somebody's going to call. You're not going to pass the call. We're going to learn how you go about dealing with phone calls. Which phone calls goes through directly to the doctor, which ones you are going to answer. So that's basically what it is. Remember, the doctors are very busy seeing patients. We're not going to allow patients to go. There is no line that goes directly to the doctor. All the phone calls in the office goes directly to the reception area. And someone over there, might be you, the medical assistant, whoever picks the phone, is going to make a decision where is the phone call is going to go next. Depends on who this person on the other end wants to talk to? What is the message? So we will learn what message calls are going to go through directly to the doctor. So you're going to say, okay, can you hold on a minute, and you transfer the call, or you're just going to take a message. So all depends also what answering services you have in your office. So once again, we're going to have a chapter for that. So just giving you a little take on what is it that you have to do. But messages, usually over the phone, you have to take message, and you need to know how to take a message. What questions you should ask? What should be written on that message? How much information should be collected? So there are certain criteria for that purpose. We will discuss it when we get there. It says right here, arranging for hospital admissions and laboratory services. Well, this is the thing. Let's say that will be done if a patient happens to come to your office, which is very rare, that the patient is feeling really bad and instead of going to the emergency, end up in the doctor's office. And you know that the doctor's office is not tailored, it's not prepared for certain situations, because we don't have everything in the doctor's office. So let's say that a patient goes there with chest pain, well, didn't think that it was serious and end up having a heart attack right in the office. Well, it's not like you immediately need to handle this by yourself. No, this is you have to do it with other coworkers. You have to do it with the doctor. If something happens, doctor is called immediately. So what you're going to do is, after the doctor addresses the situation and the doctor decides that this patient needs to be sent to an emergency or a hospital, well, usually emergency are in a hospital, so then the doctor will decide whether you have to call this number to call the ambulance. That's something that you can do. We have all these phone numbers over there. We have a directory. So they're going to ask you to call the ambulance. Then, usually, in most of the cases, the doctor arranges hospital admission because the doctor knows diagnosis. What's the reason that you're admitting this patient? Because the person at the hospital who is picking up this call is going to ask questions. And you don't have the answers. The doctor does. So for that reason, this is a little kind of not clear. So that's what I'm trying to break it down for you. So this is in case of an emergency. Now, you might be asked to call this number at the hospital for admissions, but just because these people put you on hold and the doctor is still dealing with the patient in arrangements with the ambulance, giving certain information to the ambulance personnel, it seems something like, telling them something a little bit about the patient because the patient is in a critical conditions. Now we have to release some information to them. What condition the patient have, what have happened, what have done during the time that the patient was there. So the medical providers who are in the ambulance, usually an EMT and a paramedic, they will take over and they will know what was done and what needs to be done on their way to the hospital. It's not that the ambulance pick you up and they just throw you right there on a stretcher and that's it. No, someone is going to be right on the back of the ambulance with the patient, rendering any medical, services that the patient needs, depends the condition. At the meantime, they are already talking to someone in the hospital. And that's what we're going to do from the office, not you. It's going to be the doctor. Whenever you get on call to someone at the office because they put you to hold, remember when you call, they're not going to pick immediately. So you're going to be there, standing right there until someone picks up the phone and says, listen, yeah, I'm calling, this is such and such person from medical doctor's office at this location. We have a patient that we send in over there for admissions. The doctor's going to be talking to you because they're going to ask you, then doctor, someone is ready, available to take the information for the patient that is going to be admitted or the patient that you send in for admission. And then that's it. It takes over. If it is paper medical records, you might have to look for the paper medical records and hand it to the doctor and, give some explanations to the EMTs and to the paramedics, but that's not something that you're going to be doing. That's going to be done by the doctor. You're going to be doing just the preliminary tasks. You're going to be assisting there with whatever is needed. So don't panic for this situation because that's actually not happening. Handling correspondence and bookkeeping. Well, let's talk about correspondence because yes, every single mail that comes into the office, we're going to get to that part when we get to this particular subject. So every mail that comes into the office, you have to sort them out and see which one goes to this doctor, to the nurse, to whoever else, what mail you can open, what mail is private, which one you need to, open it up and put it in the patient's file. So all those things, which information you need to enter in I want to apologize again. Oh my goodness, my computer shut down. The same problem that I'm being having. Oh gosh. Let's see if we are in the same chapter. Yeah, this is it. All right. I was like very was thinking, oh my God, I'm gonna make sure that this time is not gonna shut down. But I totally forget. I got too caught up with these classes that I totally forget about anything else. Okay, so we're gonna continue again. My apology to you guys. Always happen this nonsense. So gonna go this train medical assistant. There is no mandatory insurance, filing, greeting the patients, insurance, arranging hospital admissions, handling correspondence and bookkeeping. Oh, that's where we were. Okay, so once again, the correspondence we're gonna talk about in more detail. What things needs to be opened by you. What when it's private comes somebody else's name in there. You just have to place it in the inbox or incoming box for whoever this correspondence is for. So we will deal with that. Bookkeeping. You don't have to do no bookkeeping. So not at all. The only bookkeeping that is not bookkeeping is done when you receive those co-payments at the end of the day. You just have to count those co-payments and balance it out with the receipts that you gave to the patients for the co-payments. Because usually we don't receive payments in the office unless someone is paying cash because he doesn't have medical insurance. That is a different issue. But then in the medical records, it's going to say, okay, insurance, no insurance, pay cash. So you're going to learn in your office how much they charge per visit when you don't have medical insurance. Some offices charge, all depends on the doctor, all depends of the location of the office, the specialty of the office. So it has a variety of situations. So you have to learn that in your job. But the cheapest that you're gonna pay just to be seeing the doctor is $100. It's the cheapest. I don't know if they still charging that little amount of money, but that is more likely the cheapest. Some of the time runs from 150 and 200, which will be the lowest price for payments for the visit only. So you're gonna see the doctor, you don't have insurance. So you gotta get familiar with that in your workplace. You're gonna ask the person who's there or the doctor, do you take cash patients? How do you deal with these patients? That means how much do you charge? Because remember, we're gonna get into that part when we have to, with communication part, the communication part with the patients, that you have to explain then exactly what's going to be included within this payment. Because patients think that because you pay for the visit, it is include blood work, urine, any exam that you're going to send or whatever. No, that's not included. Or medications that you're going to be receiving from the pharmacy. No, not at all. That money that you're gonna pay is just for you to be seen by the doctor, and the doctor is gonna listen to you, your complaints, and the doctor is gonna diagnose you, and that's it. All depends of whether you're a new patient or an established patient. Remember, new patients, at least you're gonna spend 45 minutes, 1 hour with them. So we're gonna charge them more versus a patient that just come for a follow-up. So that's basically what it is. So we got to be able to, to deal with these patients and to know what is it that we're going to tell them, because this is going to be creating a problem if you don't tell them exactly what is this money that you're paying, what covers, what is it. So make sure that you get familiar with all this, because if you don't do this, remember, it's not written here at all. But this is what you're going to be facing over there. Oh, yeah. It says right there, bookkeeping, correspondence, some filing insurance and things like that. Well, what exactly you as a medical assistant going to be doing, or you are allowed to do? Not much in this case, but the few things that you have to do related to these financials, well, you need to learn it at work. But now you're gonna go there and Can you imagine you go there for the first time to work and a patient says, "Oh, I want to see a doctor. You have insurance?" "No, I don't." Then you're gonna say, "Oh, I'm sorry. We're not gonna see you." How do you know that? You need to know what is the policies of the organization, and that's what you have to learn when you get there. So you learn whether they receive cash. I have not heard a doctor that do not receive cash. It's right there, it's in your hands. You don't have to wait for the insurance to pay you. So that money, you're gonna get it right there at that front. And you're not even gonna pay taxes on it. So just between you and me. So that's basically what it is. So most of the doctors, they take cash. Oh, definitely. They take debit cards, credit cards, checks, money orders, you name it. It's money. It's business. But you got to get familiar with the policies of your organization, because you don't know. Oh, I'm going to write you a check. And you don't know for how much is going to be the check. Or you don't even know if the office accepts checks or the credit cards or money. You got to get familiar. That's what you're going to do. So one of the first experience that you can encounter is when you're doing your internship. So learn from that. Right? See how many things happens over there. Because most of those things are carried on in other offices, not everything. So that's basically what it is. So you gotta get familiar with all things. Because it's a lot easier when you are familiar with things. You don't know how much money they charge, but you know what to do, what to talk, what to look for. You know how to discuss this issue instead of just turning the patient down and says, "No, sorry, we don't do that." So just get familiar with the policies. Always get familiar with what, but if you don't know this, you're not gonna ask. But now that you know it, you're gonna ask when you start working. And you're gonna look really good. You're gonna say, "Wow, it's the first time that a medical assistant asked me that. This is a keeper." So you're securing your job because you know what you're doing. Well, there are other duties, remember, according to your scope of duty that are, state regulated. So if they allow you to do it and it is part of your duties, or the state allows you to do, remember, there are some things that the state don't allow you to do, but other states allows you to. So that's why you have to get familiar with the place that you're working at, the state that you're working at, what the laws are for medical assistants. What is it that a medical assistant actually do? Now, make sure that you don't mix this up. I'm going to be very clear with you. Just because the state regulations allows you as a medical assistant to do something does not imply that you are going to do it in the office. Listen very carefully, because it seems like I'm contradicting myself, right? Oh, well, you have certain things that you're going to do allowed by the state regulation. Yeah, the state regulations is one thing, but the office regulations and policies are others. So let me explain it to you. So let's say that you graduate as a medical assistant. Now you enter to work in this place. You know to do all this stuff as a medical assistant. As I told you, you can draw blood, you can do EKGs, you can assist the doctor with this, you can do vital signs. Well, if the doctor doesn't want you to do something over there, even though if you are allowed, part of your task are those things are allowed by state regulations. If your doctor or your office says, I don't want you to do this, I don't want you, the only thing that I want you to do is this. You have just to follow what your doctor asks you to do. Not the things that are not within the state regulations. No. You know so many things, you will learn in so much stuff. But some of the doctors, they don't want you to do everything. Let me give you an example. So I was working in an office, and one of the doctors didn't want the medical assistants to do vital signs. I said, don't do blood pressure on my patients. Don't do blood pressure. Don't do pulse. Don't do respiration rate. Don't do any of those. So these are tasks that medical assistants do. But this doctor in particular didn't want medical assistants to do it. Remember, that is the regulations and the policies of the organization. So you have to follow those because you're working for these people. Oh, but I like to do this and I want to learn. Well, if they don't allow you to do it, you're not going to be able to do it. That's basically what it is. So just because your certificate allows you based on state regulations that you can do this, you can do that, then actually you want to do it. So let's say that the doctor don't want you to draw blood. The doctor don't want you to do EKGs. Even though if by state regulations you are allowed to as a medical assistant, but if your doctor doesn't want you to do it, you just have to follow the policies of the office. That's basically how everything goes in that fashion. Remember, the person who contracts you, the one that gets your services, is going to tell you what is it that they expect from you. The same way some doctors want more. They want you to go beyond your scope of duty. Now you have to stop them and say, no, that's not something that I'm going to do because it's not part of my scope of duty. So be careful with this, because it's not like everything that you learn, you're going to be allowed to do it. And this varies from office because every office has their own policies. So you're working in this place, now you move to another place, and he says, I'm not going to do that because the other office didn't allow me to do that. No, you're in another office. This is a different management or a facility. So just telling you that so you don't get a little discouraged. Because I have some medical assistants that have gotten a job and then they told me, hey, Professor Hoyer, I got a job and these people didn't allow me to do what I learned. They want me to do just this, and all the time the same. I said, remember that I told you that the policies of your office, you have to follow them. You should not go beyond your scope of duty, but if your doctor doesn't allow to do certain things, then you're just gonna do whatever they allow you to do. That's it. I mean, I couldn't be worried because the less work that I have to do for the same pay, the better. You know, I will look at that side. I always see things in a positive way. Now, oh, but I'm gonna forget how to do this or that. Well, then you look for another job and you move to another job. And when they interview you, you ask. Remember, every single time that they interview you for a job, they ask you, what is it that you were doing before? What is it that you learned? So then when they ask you, you're going to say it. If they didn't say it, oh, I just need a medical assistant. Okay, by the way, what are my duties here? What is it that I have to do? I have to work in the front and in the back. Do I have to do the administrative part and the clinical part? I am the only medical assistant here. How many medical doctors are in this office? Because remember, you have to ask those things. Those are important. It's not the same that if I'm working with one doctor and I'm the only medical assistant, or I'm working with two doctors and I'm the only medical assistant. I have to serve this one, that one for the same price. And I have to do everything. I have to be in the front, I have to be in the back, I have to be assisting them. So when is my time off? So if we have questions, we have to ask. It's not like, oh my God, I've been so happy that I got the job. So I'm not going to ask anything. No. I'm not even going to ask how much they're going to pay me. Forget it. I just want the job. I just need it. No, because then you can encounter situations in which you're not going to be comfortable with. And whenever you're going to ask, they're going to bring it back to you. Remember that I asked you a question when I interview you? Do you have any questions? You never ask those questions. You ask the questions the day that you're going to be interviewed. Am I going to have benefits? Am I going to have vacation? Am I going to pay sick days? Am I going to have holidays paid? Do I have to do overtime? I'm going to be compensated for it. How many patients do you see here in this office? Oh, 40, and you're the only one? You're going to be dead by the time that you finish your shift. So that's the things that you ask all the time. And I'm going to be introducing you with all those things in this administrative part, whatever part, because this is the reality. This is what's going to happen when you start working. And even before, remember, during the interview, you're just going to ask in a very professional way. And there is nothing wrong asking about how much money they're willing to pay you, about salary. When I was hired, I didn't ask many questions for the first time because, my English was horrible. And I was so happy that I got the job. So a lot of things, but I'm telling you what you should do now because you do speak English. So things have changed, times have changed. So nowadays, you have to ask all these questions because later on, they're going to be asking you to stay late. And then you're going to say, oh, I have a family issue. Oh, I have this. Guess what? They're going to get rid of you. But if you discuss these issues ahead of hand, now you're prepared. Oh, by the way, remember that I discussed this with you? Yeah, but if you need someone right now, maybe I can stay today, but I cannot do it because I have responsibilities. I mentioned it to you. But if you never mention, they are assuming that you're available all the time. So you should ask questions. I always ask questions when now, the first time I didn't ask, but then, I didn't know how was this. I never worked in my life before, so it was something new for me. But now I'm teaching you because I learned a lot of stuff. So that's basically the administrative duties. Of course, you have a lot of things to do, but these are the most basic. These are what you're going to encounter in your office all the time. Any questions? Okay, moving on. Okay, so it says right here that the medical assistant program is a very flexible career. Well, I don't know what they imply by that, but you have lots of opportunities. Remember, you can work in the front desk if that's what you want. If they need someone to work in the front desk, just answering the phones, registering the patients, making appointments, giving the patient referrals, collecting the co-payments, just talking to the patients in the front. Well, you can do that. There are some jobs that they need you for that. Or you want to be in the clinical part, you're just going to be doing that. You don't want to be dealing in the front desk with anything. That's me. I don't want to be dealing with any patient in the front. Not that I cannot handle it. I can handle it, but I'd rather be on the back, have more peace of mind. Some people are very good talking and engaging with the patients. Well, if you have that personality, probably that's the part that you can do. You pursue that. But if you're in the clinical part also, if you are the type of person that you are more kind of hands-on, because we are not the same. You see, I'm the type of person who wants to be on the back, drawing blood, doing EKGs, doing this and that. I don't want to be, directly involved with the patients. But sometimes, you're going to have tough times with the patients because you are the first person that they're going to meet when they come into the office. And if they are angry, they're going to get all this anger on you. They're going to blame you for things that you didn't do. But hey, that's how it is. So it is flexible. You can work part-time. You can do evenings. You can, depends where you're working, of course. You can do weekends. It's gonna be a little, difficult to get just weekends or evenings, depending, because remember, has medical offices. They usually don't open evenings, so it might be hard. But some of the offices open Saturday, so you might be able to kind of, squeeze there. So that's basically what it is. Says right there is no mandatory retirement age. So what it's trying to tell you right here is that, you can work as long as you wish. Because in the medical field, it's a kind of relaxed type of job that you do. It's not a physical job. It's more like a mental, psychological job, but it's not physical. Because remember, after a certain age, you cannot lift certain things, do certain, move certain heavy stuff, or running back and forth here and there, going from the first floor, second floor, running on streets, or moving stuff, or driving, or construction. You see, it's a totally different issue. So you can be 70 years old, maybe 80 years old, still you can be working as a medical assistant. No problem, as long as you mentally fit for it. You can work as long as you want. So that is actually what, it is trying to tell you right here. These programs, it says right there, that are more suitable for non-traditional students. So I don't know if you know what is traditional and non-traditional, but I'm going to explain it to you. Traditional students are those students like, the high school, people who do not have responsibilities. The younger population, that's basically what it is. Adults usually runs into the category of non-traditional students. See? When I do all the things that, I explain it to you, I'm giving you the test, you can take it home. I don't like to give homework, something like that. It's because I know that you have other responsibilities. That is called non-traditional students, are adult students that have other things besides just going to the school, something that can accommodate their schedule, or, the lifestyle that they have. So that's basically what it is. And it is a short program. It's not that long. And you're learning a lot of stuff and you can get a decent job. Remember, medical assistant is making, well, all depends where you work, but mostly it's between $20 and $35 per hour. So if you want to make more than $25 per hour, you got to be working in a hospital. Most definitely. But it's decent because the minimum wage is like $14, $15. So that's what it's trying to imply right here. So it says right there that most of the medical, oh, not yet. It says that the trained medical assistant is a valuable asset to the physician's office. Well, to the physician's office, to the hospital, wherever they have patients. You're going to be a very, very important part of, the staff that's going to be doing all these tasks. Because remember, the medical doctor cannot do everything. They have to have someone who is going to delegate these functions. And if I cannot pay a nurse, well, I'm going to pay a medical assistant. I'm not going to hire a phlebotomist or a EKG technician. I want someone who has all those included. So that would be a medical assistant. So that's what is considered, that you are an asset to the company, because you are. Because you know a lot of stuff and you can, help any medical office or any medical department, whether it's in a hospital or doctor's office, to accomplish all these tasks that the medical doctor is not able to do, because the medical doctor's diagnosing patients, is evaluating patients, is already in a test, medication. So somebody else have to do their job. Who's going to answer the phones? Who's going to refer the patient? Who's going to make appointments? Who's going to collect the money? So a lot of things that you can do over there. And you can decide whether you want to do the administrative part or the clinical. Remember, if you go to work in a hospital, you do not have to do anything with the administrative part. Nothing. Everything will be clinical. So basically, that's what is important about the medical system. And the job opportunities. There's tons of job opportunities. Once again, it's mentioning right here that, the medical assistant field is growing. It's not going to stop. Everything is growing in the medical. Have you heard about any medical positions that they want to get rid of it? Okay, we don't need more nurses. No, nurses are in demand. And because the nurses are, expensive to keep, well, I'm going to have a certain amount of nurses, but I'm going to have medical assistants as well. And the nurse is going to do just medications right there, taking care of the patients, and a little higher trained job, and you're going to be doing whatever else. So that's basically what it is. So it's a lot of stuff. So it says right here, remember that I've been telling you that medical doctor's office are the place that where more of the medical assistants are going to start or are going to be hired. 62% of positions are in physician's office. That's how it is. I believe there's more than that, but again, remember, this should be like a transition time for you. Enter one of these doctor's offices, get some experience, train yourself, and then apply to work in a hospital. Because most of the hospitals actually want someone to have experience. So it's there. And it's not difficult. All depends of your availability, how available are. Remember, sometimes when we are not available to work full time, there is still the possibility of working part time. And we decide what is it that is more suitable for us. Benefits. So for those who I have been, I've been teaching prior because we have new students. I told you about, the difference between working in a hospital, working in a doctor's office, because the doctor's office doesn't offer you all these, you know, all these perks, if you will. Doctors' offices usually don't offer much. They just offer you salary, and probably that will be it. If you want to start working in a hospital, things are going to be totally different. Then you're going to be thinking about health insurance. You're going to get medical insurance. Well, life insurance, I'm not pretty sure about that. You may be making enough money that you can get your own life insurance. But you are protected there while you're there. And if something happens to you, then probably they're gonna, carry with the expenses. Dental and vision insurance. Remember, just having health insurance does not imply that you're gonna get dental and vision. So you gotta be very, very careful when you ask questions. Am I gonna get health insurance? Yes, you will get health insurance. And then it turns out that you wanna go to the dental office, you're gonna make an appointment, or you have, glasses that you probably need or have problems with your vision. And they tell you, but your insurance do not cover that. But you're gonna find out at the last minute when you need it. So these are the things that hospitals will offer. But you gotta make sure that you ask, because health insurance by itself does not imply just medical coverage, not dental or vision. Cafeteria benefits. Well, I think that this doesn't apply anymore. So back in the days, medical personnel have a cafeteria, have a lounge area, and they went over there and they have, refreshments, they have sandwich. I don't think so that is going on anymore. So we leave that out. The life insurance and the cafeteria benefits. Been working in hospitals and things like that, and I haven't seen that they have a vending machine, if that's what they call cafeteria benefits. Anyways, maybe some of you might have experienced something, but in a different arena, different industry. But medical have changed a lot. Now they don't want to give it, these giveaways they have been taken away. Vacation and sick time, these are something that you're gonna get. But remember, if you work in a hospital, in a doctor's office, you don't get any of this. So vacation, remember that your vacation starts after a certain period of time, and they're gonna start giving you a certain amount of days per time work. Sick time, every single patient is entitled after the probation time, which is 90 days, to get sick day. But you have certain amount of sick days. You got to make sure that you are familiar with this, because there are some sick days that if you don't claim them, you lose them. So it's not cumulative. So you gotta get familiar with this. Oh, I'm accumulating these sick days because next time I need it, because I'm gonna go and kind of have this little vacation. They're not gonna know. I'm gonna just take those days together or add it to my vacation time. Well, you have to ask whether you can do that or not. Some of the places don't give you, they give you the vacation, but the vacation is gonna be broken down. So if you have 2 days or 3 days, they say, no, you're gonna take 1 day at a time. So find that out. This is not just like because it's written, oh, I have a vacation, so I can take it. And you're not gonna be able to take it whenever you want. It's whenever it's available for you according to your tenure in your job, your seniority, if you will. And there are certain times that you are gonna be able to take the vacation. It's not when you want. Oh, I want it in December because I'm gonna go and spend time. I'm gonna go out the country or something like that. Plan for this day. There's a birthday, so I'm gonna be there. No, it's not when you want. It's when it is available for you. You have to ask before, but they will give you the time. Be careful with all that. So you have to ask those things. And I'm telling you, I've been through all this, so I know how it works. Pay holidays. Pay attention to this because some of the organizations, they give you the holiday off, but they don't pay you for it. And if you work during the holiday, they're gonna pay you double. Oh, well, the way that they pay overtime. So you need to find out how it works. Because yeah, very nice. I have a holiday, right? And they asked me not to come to the workplace. Am I getting paid for that day? Or they just give me the day off like I didn't work? So no, this is a right that we have. But you need to ask. Because some of the people, some of your employers are going to tell you that. Membership for credit unions. Well, that depends on the organization, if they have any of those. So I thought they were talking about unions by itself. Well, this is another thing. I don't think that is here. No. So unions, yes, some particularly hospitals, most of the hospitals has unions, and medical assistants qualify for that. So after a certain period of time of working with the company, you can affiliate yourself to the union. Well, of course, you have to pay them. They're gonna deduct from your paycheck some amount of money to belong to the union, but they're gonna protect you. If something happens, you get in trouble, somebody trying to get you in trouble, they're gonna help you. Not to mention that if you have a union, you're gonna have the chance to get tuition reimbursement just in case you're gonna move up and start something within your field. So they will pay for it, or at least they will give you some assistance. That's important. I got that when I was a medical assistant. We have 1199. And to be honest with you, it paid almost half the money for my medical. That was a lot of money because most of the money that I did during my bachelor's degree was paid by the union. So when I finished my medical, I didn't have this chunk of money that I have to pay back. I have like half of the money. It was a lot. It was like $100,000, a little more. But it's not the same as, having a loan for over $200,000 versus $100,000. So that was a lot. So it helps. So these are the things that you have to, find out whether you are, they have these unions at your workplace so you can take advantage. That's what many other things might happen. So sometimes they offer you bonuses. I did have that at the end of the year, not just a Christmas card. No, they gave me money, gave me a check. So that's basically how it works. There are a lot of things that, can come your way when you work for a large company. But remember, I'm not discouraging you. I'm not saying, hey, listen, just go work for a. No. You're going to start anyway. You're going to put your foot inside a medical office if that's the opportunity that you have, but then gain your experience and then apply for hospitals. And that's how you're going to get the money. And that's how you're going to get all these perks. Other than that, you're just going to be dealing with your salary only. Any questions about benefits that might be offered to the medical assistants? See, if you work for a doctor's office, I almost forget, the scrubs, you might have to buy it yourself. Hospitals, they give you the scrubs, and they're not going to give you one pair. They're going to give you 2 or 3, and every year you can ask for more. So those are savings. Okay. Professional appearance. This is something, well, everything that I'm telling you is important, but this has to do with you personally. So these are not benefits that you're going to receive. These are not the tasks that you're going to do. You're going to perform whether you know it or you don't. No, this is how you present yourself. Very important. And I just talk about uniforms, scrubs, because remember, you have to dress professionally when you work in these places. Most of the time, 99% of the time, you have to wear uniforms, scrubs, or any other type of uniform, whatever the case may be. Because that is going to give you, like, it's going to differentiate you from patients, visitors. If you are dressing your regular clothes, how do I know that this person works here? So you have to present in a very professional way, well-groomed. Your scrubs needs to be clean, iron, not all folded, all wrinkled like you slept with, and dirty with all the stains of coffee, ketchup. I've seen it. And if you have a lab coat also, it has to be very clean, because remember, lab coats are usually white. So you are the image of the office. So if I enter an office and I see anyone in the medical, any one of the staff members over there, and it's dirty, smelly, the hair is not fixed, stains on their clothes, I don't feel safe in this place. I don't want this person to get any close to me. . So that's how we present ourselves. That's how we present our office. That's why you have to have at least. So if you use one, then the next day you put the other one, then you watch this and then alternate it. That's how it works. Because remember, patients look at you and they create an image of the office. Say, whoa, wait a minute. Look at this person. I'm sad. I don't want to be here. I'm taking my business somewhere else. And for ourselves, self-esteem. You don't want to be, in the situation that someone is gonna call your attention in something. That will be embarrassing, isn't it? Somebody tell you, say, listen, you have all these stains in your clothes. Are those blood? No, it's ketchup for my lunch. Oh, seriously? So it doesn't look good at all. No professionalism at all. So that's not good. So here we have medical assistant, someone, probably the doctor sitting there, or I don't know, someone else right there. But you have to be clean, well-groomed. You have to take care of all physical aspects when you work in an office. Okay, remember in a workplace is very demanding physically, I would say more likely psychologically. So we have to rest very well at home. So we're ready for the next shift. So we're not falling asleep on the counter or where patients can see you. So that wouldn't present a good, that would not be nice. So if you want to keep your health, to the high standards for you, you have to eat a balanced meal, do exercise. It says healthy lifestyle. What it's trying to tell you is exercise, do not smoke, do not drink. You can drink with moderation, meaning in your weekend and some social gathering once in a while, because that's going to affect your health. Remember, in our office, we need to be aware of what's going on. When you are not resting, not eating properly, you're not going to feel giving your 100%. And we're going to notice, we're going to see it. So again, this is for your own good. But then remember, you are representing the office. So depends how I see you. I assume that, everybody will be the same in the office. If you treat me with disrespect, I'm going to assume that everybody's going to do the same in your office. If you're not well groomed, I'm going to assume that everybody is not like that. Says during training, they mostly referring to the internship, personal hygiene. But this doesn't have to be during training. This has to be something that we do every single time. Has to be part of our daily activities. Taking a shower every day, wearing deodorant. Remember when you take the train? Been there, done that, some things, smellings everywhere. People is in a rush all the time. You just kind of measure your time to get from here to there, so you don't have time for other things. Oral hygiene. Look what it says right here. This is important. Well, there are a lot of things that are important. Avoidance of colognes or perfumes. Remember, colognes for males, perfumes for females. Some people put too much of these smellings that, I'm allergic to them. So if someone is close to me and it has too much of these perfumes or cologne, I'm gonna start sneezing. And in the workplace, it's not a good thing to do. So remember, your patients might be allergic to these odors. Makeup has to be very conservative. And it is true, I'm telling you, particularly when you are a new kid in the block, when you are a new employee. Do everything by the book. You should keep it that way, but if something happens after that, hey, it's up to you. But you should start with your right foot when you start working. Show everything that they want to see on you. Oh, but I like this, but I like that. Well, unfortunately, that might be the reason why during your interview you didn't pass, they didn't select you. I'm telling you, be professional. Sometimes, too much is not good. Less is more. Nail polish. Length of the nails. See, all those things, because remember the type of job that you're going to be doing. Nails can be a hazard, can put the patient at risk, can put you at risk when the nails are too long. So that's why we have to kind of, go over all these things. Because one thing is when I'm at home, when I'm doing something else. But when it comes to work-related situations, we have to be a little more conservative. Believe me. So again, all these hairstyles and colorings and things like that sometimes, can be a negative factor. Particularly when we start in a job. Because that's the hardest part. So go as conservative as you can be. And that will be very simple. See, it says nice looking uniforms or scrubs. Well, when I'm saying nice to visualize, they are clean. They are not wrinkled. They don't have stains. They don't have, well, what else can I say? Now, nice looking uniforms, particularly for females, is not to fix those scrubs that they are so tight to your body that you cannot move. Remember, scrubs like sweatpants are supposed to be loose, not tight. Remember, you have to bend sometimes to pick up things, maybe help the patient to go into the table or to the wheelchair back and forth. Can you imagine those scrubs so tight and as soon as you do a movement and they break open, they crack? That's not nice. So this is a workplace environment. It's a professional environment. Piercing, particularly piercing of the nose, the tongue, is a no-no. The lips, they don't look good. I'm telling you. Yeah, I like piercing, but this and that. Well, in your job, particularly when you go for the interview and sometime after, stop wearing those things because that can be a deal breaker. So remember, we want that job, we want that job stability. I know probably you're thinking, oh, I have seen these people like this. Yeah, there is a lot of things going on, but it's not for the new ones. It's not someone who just got the job. Remember, at the beginning, we start working like giving 100%, more than 100%. As time goes by, we start kind of loosening up a little bit, relaxing a little bit, and then we start creating all these bad habits. That's why you see these job openings for medical assistants in the same location that they don't even remove that ad from there. Every single time that I check, because I check stuff to see how's the market. And I see all these medical assistants. Oh my God, that office always looking for medical assistant. What's going on? Because they don't last long. Two reasons. One, because they train over there and they start working somewhere else, because that's how it should be. I'm going to be trained right here. Then I move to a place when they require more experience, but they're going to pay me more. They're going to give me more benefits. Some others, because they were fired, because they didn't follow the policies of the organization. They have a bad attitude. They come late. They asking for off time or they call in sick all the time. Enough is enough, so the doctor is going to let you go. The hospital is going to let you go. So the position is open. So they don't want to bother removing the advertisement from these web pages. So they leave it there and they are collecting resumes. So whenever something happens, they have a bunch of people that they can call and interview. So that's how they do it. So that depends on us. Remember, it's our responsibility. And this is personal. So shouldn't be something that somebody has to tell me. Alberto, did you take a shower today? What's wrong with those clothes? What is that haircut? When was the last time that you got them? You haven't even shaved. What's going on? Something wrong? That's not good. Because remember, they're going to call you. They're going to write you out. So shoes. So important this. People don't understand how important it is to have a comfortable, clean shoes. People don't understand that. Remember, this is a place when you're going to be moving around, that you're going to be exposed to so many things that a little fall can get you in trouble. You don't need to wear high heels or any of those. So for, security reasons, there are certain type of shoes that medical personnel uses, wears, because it's a lot more comfortable for us. Because I already talked about, did I say, piercing? I saw right here. See, particularly no facial or tongue piercing. Remember when I said facial, it's nothing on your eyebrows, on your nose, on your lips, in your tongue, all those things. If it is a female, if you have piercing in your ears, that's not a big issue, but it has to be very conservative. You're not going to be wearing those big earrings or something like that. That can be, causing a hassle for you and for the patients. Jewelry, it has to be very limited, if any. I think that I told you guys when we were doing phlebotomy, I don't wear nothing in my hands, in my arms, nothing. No rings, no watches, no bracelets, nothing. Why? Number one, because it is a danger to have those. It is a hazard. Bacteria deposits underneath all these, all these ornaments that we wear. So I'm not going to put myself at risk of capturing all these conditions, these microorganisms that the patient has, and bringing myself and to my family. No. I might lose them because I have to remove them because I have to wear gloves all the time and I have to wash my hands all the time. So if I'm removing them continuously, I might lose them. I might misplace them. So I don't want to go through all that. So once again, this is a focus of infection. So I don't want anything that the patient have to come to me. So I have to take care of myself, making sure that, once again, less is more. The less that I wear. And I got so used to that, even though when I'm on vacation, I don't put myself, and I don't wear anything. I used to like watches, not anymore, not even used to. I have my phone, so if I need to watch the time, I just check it out. That's it. I feel that anytime that I put something on my arms or hands, I feel uncomfortable with because I'm not used to. It's been a long, long time. When I'm talking a long time, I'm talking about years since I started medical school. And that is a long time. And actually before that, because I was working as a medical assistant. So again, this is for your own safety. You don't want to be wearing any of those things. Education and training. So again, most of these programs, see, medical assistants last between 3 months, 5 months, 6 months, 9 months, 1 year. It can be an associate as medical assistant. So meaning you're gonna be going to school for 18 months, 16 months. Well, all depends what is it that you want to do. Regardless of the time that you do to take these courses, you're going to be a medical assistant no matter what. It's just that you pay more money, you spend more time, and probably you're going to get credits. Remember, the school at which you are right now, you don't earn credits there. But if you're doing an associate's, then it lasts like 16 to 18 months, then you are going to get credits. So if you want to move to another major, and some of these credits might be transferred, but still your medical assistant. So you're going to be learning the same things, just going to be more expensive because they're going to give you other classes that you're probably going to need for something else that you're going to do. Well, it is longer the period, so I have to, the program, so I have to put something in there, right? So they can keep you longer. But when you apply for a job, whether you have an associate or you have your certificate for 9 months, you're going to be in the same level. You're going to be paying the same amount of money. You're a medical assistant. You apply as a medical assistant. It doesn't matter. So that's something that you need to understand. And you're going to be learning the administrative and the clinical duties. And you're going to be doing EKGs, phlebotomy, vital signs, and probably you have to be answering the phones, depends on where you're going to start working. It's not that because you have an associate, now you're going to go directly to work in a hospital. No, you're a medical assistant. And you are applying for medical assistant. I don't care if you were a doctor in your country. Here, you're a medical assistant. So because you learn a variety of tasks in the administrative and the clinical part, well, you can assist very well in the office. You can substitute for someone. Somebody's not able to, to come to work. You might be taking over the front and the back. That's what you've been training both. Even though if I like the clinical part, but the other person calling sick or something happened to them or have a vacation and they didn't bring anyone covered for that person, I might end up doing their job. So I'm going to do the front and the back. So that's what we prefer, to have a medical assistant versus someone who just know how to answer the phones, but they don't know how to do EKGs, how to draw blood or anything else. So no, I don't need a receptionist only. I need someone who do more than that. And that's where you come to play, because you're actually learning a lot of stuff. Believe me, there's a lot of stuff. And the thing that you have to do, if you put all of them together, there's a lot of stuff. Classroom training. So here it is, says, well, where are you, getting your training? What type of institutions offering these trainings? Well, there are private, there are for-profit, non-profit organizations, there are colleges. So all depends. Whether you're going to pay from your pocket, whether you're going to get financial aid, whether you are going to get a loan. So there are many institutions where you can get trained to do this. I mentioned some of the things. A certificate. So you can have a certificate. Remember, as a medical assistant, you can be certified medical assistant. All depends on the time that you spend in training. So certificates are for these people who do less than 1 year, those students who do less than 1 year. That is a certificate. Where is a diploma? Someone who do training for a year or a little more, 12 months at least. That is called a diploma. What is an associate degree? Well, that is someone who do more than 1 year. Again, Gonna repeat it. Whether you are certified, whether you have a diploma, whether you have an associate degree as a medical assistant, you are going to get paid the same. You're a medical assistant. You're an MA. That's it. It's just the difference of timing in school. But you learn the same things because that is what is required for a medical assistant. Now, an associate, you will earn credits, remember. So all these courses, anatomy and physiology, medical terminology, medical insurance, you will get credits for it, like college credits. So you can transfer them if you want to move or pursue something within your field. Because if it's not within your field, none of these credits are going to be valid or accepted. So once again, just because someone says, oh, I have an associate degree as a medical assistant. Well, don't say anything. But just for you to know, my answer will be, so what? You're a medical assistant. And you're doing the same things that I'm doing. And you're getting the same pay as I'm being paid. So it's no difference. It's just the length of time where you're receiving the training. That's it. So there is no difference. Now the difference is if you are a medical assistant, you have an LPM, you have a nurse practitioner, now you have a nurse. Oh, those are totally different majors, different professions. So that's basically what it is. Any questions? Externships. See, we can call it externship, internship, it doesn't matter. Back in the days, it was called externship. Why? Because you no longer in the school. So I'm sending you somewhere else to practice what you learned in school. And they call it internship because you're gonna be an intern in that facility when you're gonna be doing your practice. So either or is considered correct. But nowadays they are using more internships versus externships, but it's the same. So this is the time that you, after completing all these theoretical academic training, you're gonna go to a medical facility to practice. That's basically it, to gain experience on those skills that you learn. Phlebotomy, EKG, vital signs, measurements. Now, you're gonna learn a little more how to interact with the patients because during the class, you were interacting with your classmates. Now you are in the real world, dealing with the real patients. Now you are actually answering the calls from them, taking messages from them. So now you're practicing. Drawing blood on patients, real patients, not between yourselves. Remember, it says right there that experience is before graduation. That means that if you do not complete the internship or externship, you are not completing your program yet because your program is 900 hours. So you're going to have 600 hours in lectures and some practicals and 300 hours that you're going to be doing in an internship. So if you don't complete that, you're not a medical assistant yet until you complete it. So you have to go through all this. And the sooner that you do it, the better. Once again, we have a little issues here because we are non-traditional students, right? You have your obligations, you have your job, you are providing, the financials for your family. You might be a single mother, single parent. You might have other responsibilities, so you're not gonna quit your job just to go to the internship, right? So these are the little things that well, not so little, inconvenience that you might have to start, working on it before, you get to this point of the internship to see how you're going to make arrangements for this. Once again, for me, it's not just to teach, internship is this, you're going to do this practical thing. Well, it's written there. No, there are other things alongside, more important things, like what I'm talking to you right now. So in advance, you have to make plans. What is it that you're going to do? How are you going to arrange this internship? Because remember, you have to do it. And you cannot let pass too long time after you finish and go to your internship because it has some type of limitations. For financial aid purposes, for the school politics, and for you. If I finish something, I did this part already. I need to do this. I want to do it as soon as possible. Again, considering all these, little issues here and there that I have to fix before that time, but you have to be preparing from day one. How you gonna manage to do that internship? It's very important. Number one, you have to do it. Number two, it's so important because you're gonna gain experience. That's your first experience on the job. Let's say that you were never exposed to the medical, particularly to this side of the medical, then it's gonna be a very valuable experience. I'm telling you. So that's something that you need to consider. Preparing yourself. Talking to the person, the director, whoever is in charge of doing the internship in advance. I have this situation. Sometimes it's just very hard because doctors' offices, when you have most of these opportunities, they don't open in evening time. They are not open at night. Sometimes they aren't even open on weekends. Under 300 hours, that's a lot of time. When you start doing like 2 hours, 5 hours, you're never gonna finish. And someone might not be willing to, to take you like that. So start making plans now before the time, comes. Any questions? Continue with the internships. It says right here.
I have a question.
Go ahead.
Can we do it's only morning, the intern, it's not evening?
Well, the problem is that doctor's office don't work in the evenings because most of the sites that the school has and the easiest way to get you through this are medical offices, doctor's offices.
Okay.
So if you are someone who has a job during the daytime, well, you have to start making plans in advance how you are going to manage to do the internship. So That's something
But
that you
can
have.
we do like, let's say we could do like 9 to 12 or 9 to 1, right? Something like that.
Well, that is something that you have to discuss with the person who is going to take you for the
Oh, okay,
internship. These people are very flexible,
okay.
but not too flexible to say, okay, come 1 hour only, and then no, the 1 hour is not going to be
Yeah.
good. But
Okay.
yes, you can do like part-time. They try to accommodate you. There are some places that they try to accommodate you.
Okay.
Yeah. But once again, ahead of hand, before this happens, you need to talk to the director or the placement person at the school and tell them what your situation is. Don't assume that they know, oh, you work, yeah. Some people work part-time, some people work some days, some other days don't work well. The time that you have available, you can use it for that purpose.
Okay.
So that will be, you know, something that you have to discuss in the school. It's very important for all of you. If you have plenty of time, well, good for you. But if you don't, as many of you, well, then, you know, you have to talk to the placement or the director of the school and make sure that you explain your situation and see how they can make arrangements, how you can accommodate yourself and try to, you know, to deal with this situation before the time, because at the time when, okay, this is your last module right now, in 2 weeks you're gonna go into the internship, you're not prepared, you're not ready, that's not gonna be a good thing. So in advance, we're gonna prepare.
All
Okay,
right. Thank you.
no problem, anytime. So let's take a break, and when we continue, we're gonna continue with this. Let's take 30 minutes, so we come back at 7:30. Okay, good. 7:30. Okay, so we're back. I hope you guys enjoy your break.
Thank you.
Good, good. Okay, so let's continue with this chapter almost done, and then I'm gonna start another one a little bit, go do a little overview, and then go to rest, go to do whatever we have to do before we go bed. Okay, so we were talking about these internships or externships. Now, how this works. So the school is going to send you to a site. Now, I'm going to tell you something else that you can do on your own. If that is something that is going to accommodate you, you make arrangements. But let's talk about how that works. When you're ready for the internship, you're going to talk to the placement, the director of the school. They're going to tell you which side they have available. So in that side, there is someone who's going to be in charge of you, your training. That can be a supervisor. That can be the office manager. Usually the doctors do not take up on these responsibilities because they have other things to do. Besides, they don't know what medical assistants do. So it has to be a senior medical assistant, the office manager, the nurse in charge, whoever is there is going to train you. Remember, internships are for training. You have not completed the program yet. You're not working. You are gaining that experience. You are kind of entering the real world. That's basically what it is. So someone has to be with you. Somebody has to shadow you. Somebody has to be next to you when you're doing things. It's not like they're going to tell you, okay, we have like 20 patients over there, start drawing blood. That doesn't work that way. Even though if you feel comfortable, remember, it's your first time in that place. You got to get to know how it works. How is the environment in that office? Remember, we need to get a little adjustment, right? So that's what you need. So you're going to go there and they know already they're expecting you because usually they do an interview prior to that. So you go there, we send your resume, and they already expecting you, and they're gonna tell you what is it that you're gonna be doing. But this is the time that you're gonna tell them what you learn. You know how to draw blood, you know how to do electrocardiograms, you know how to do vital signs and the measurements. The rest, you're not gonna say, oh yeah, do you know how to verify for insurance coverage? No, you didn't learn that. We don't teach that. We tell you, but we didn't show you how to verify. We talk about medical insurances, the types of insurances that your office might be accepting, but we didn't put you through that. That's what externship is all about because it's part of the program. So whatever we cannot do, we're gonna delegate it to the internship. So someone is gonna be there helping you. So that you get this proper training. Remember, it's not like you're gonna be thrown into an internship and then, okay, help yourself. No, that doesn't work that way. So you're always gonna learn things that you are not familiar with. The machines you're not familiar with. You need to know what type of machine is it, how you turn it on, how you maneuver with those devices, how you operate them, and everything else, how you deal with the patient. If I see you interacting with the patient, then I'm going to try to do the same. So you're going to be shadowing someone. That's how internships are all about. Sometimes we are a little nervous about the internship, thinking, okay, I didn't learn much this. I don't feel too comfortable. I'm kind of nervous. We're going to be nervous regardless. I become nervous sometimes when I go for an interview for a new job. I don't let them see it, but inside of me, I'm nervous. So I'm a human being. Sometimes I have something in mind. Sometimes I said, well, I want this job. I really want to be doing this position that I applied for. So I want to get the job. So you become a little nervous because sometimes, people just ask you stuff that you weren't prepared for it. Still, you get nervous anyways. So that's the thing with the internship. So we're going to have someone over there that is going to be in contact with us and is going to be telling us how you're doing, how you're performing, and if they have any issues with you. So there is a communication between the school and the office when you're going to be sent to do the internship. Remember, your internship is like your first job. And even though if they don't pay you, this is a voluntary, this is part of the program. You haven't graduated yet. You need to complete that part. We need to have an evaluation for the person who is training you. An evaluation that says this person did this and he approved and he passed. Because that's like giving you a final exam. So without that evaluation from that person, from that particular office, when you're doing your training, you're not graduating. So you gotta make sure that you do your best during that time that you're gonna be there. Because remember, sometimes if something goes wrong, they're not gonna give you any hours. The hours that you already did, they are gonna be lost. This is not transferable. So don't think, oh, I did 10 hours. So if I'm going to another one, I'm gonna do 5 hours. So in one, I'm gonna add them up. It doesn't work that way. You go to an internship, you have to complete it right there. If for some reason you cannot do it, then, and if you kind of let go, they're not gonna give you no evaluation, no timing, nothing. So you gotta be very careful how you plan and you make arrangements for these internships, because it's unfortunately your responsibility. You have to commit to the schedule that you agree with, the time that you agree with, like any regular job. You have to be on time. You have to dress professionally. And if they tell you, well, this is from this time to this time, you have to go at that time. Because this is the thing, that if you get kind of thrown out from one of the internships, not only you're gonna lose the time that you did there, but you're probably not gonna get another internship. You have to get your own. So you have to take it very, very seriously. I'm telling you this because, oh my God, I have done so many things. I used to be a placement coordinator. So actually I didn't place them directly, but I have someone else who was doing that, but I have to go to the places to visit you and see how you're doing and make sure that they are allowing you to do the things that you need to learn, so we can prepare you for the job. And I get along with these people at that time, but that was a long time ago. So once again, I know how it works. So you got to be very, very, very disciplined with this. So I'm telling you, and I'm telling you because I know that you have your own responsibilities and you don't want to mess up. Trying to get some time off of work or your extra time that you have to spend to family or do something else, you're going to waste it going there and then losing those hours. So you have to be committed, okay? So that's how the internship is all about. They're going to give you a time sheet, a bunch of stuff that they have to sign, and every single time you go, they're going to sign you in just like if you were working over there. And you're going to be doing most of the things that the medical assistants do in that particular office. Once again, Somebody's going to be training you. You're going to be with someone. You're going to be shadowing first. And then if you feel comfortable, they're going to ask you. I did that. I asked someone, I said, listen, can I see how you draw blood? Oh, I thought you knew how to draw blood. I learned how to draw blood, but in between classmates, but now I'm really with the real patient. Can you kind of, explain me? Let me see how you do it first, how you interact with the patients, and then I will do it next. Because you feel a little, nervous, regardless of how much you know. You're gonna be feeling nervous, but that's how I did it. Then they allowed me to do it that day because it was in a hospital. They didn't want me to be around the hospital going to this department or the other because they were switching me. Oh, go this place, go the place. Every day was doing something different. Then the laboratory says, no, I want to have him here. He's very good for drawing blood, and I want him here. I don't want anywhere else. But it didn't last too long because they hired me the third day that I was working there. So it was a good thing. Now, once again, these are the things that you have to do as a medical assistant. Remember, always ask. It is better to ask than to do something that you don't feel comfortable and make a mistake. Because remember, they're going to kick you out probably. So you just follow all the regulations, ask questions, Because if you don't ask, then they're going to tell you, what didn't you ask? If you ask too much, or were you asking too much? But you know what? I take that side. I ask because I do ask a lot of questions because I want to make sure that I know what I'm doing, that this is the way that you guys want me to do it. So that's basically what it is. So here are I believe there is a medical assistant and a doctor probably. And then, they look clean, they look nice, they look neat. That's basically what it's trying to tell you. Probably it's doing the internship, maybe not, who knows? But the purpose is to see how they are presenting themselves. Okay, so what exactly because you're gonna be the extern or the intern. So what exactly you have to do? So, or you should be expecting in your workplace. Remember, this is like your new job. You have to be very proactive. But most importantly, be open to constructive criticism. See, people is not attacking you. They are telling you how they actually run their business over there. So we learn from them. Remember, this is an internship. Probably you're not going to stay there working. So you're learning something from here. You're going to learn something from your next job and so on and so forth. So you're going to be learning lots of techniques, lots of things, and you're going to adjust to the one that you feel more comfortable doing it. But we have a problem with people who tell us how to do things. This is not that negative. It is a positive criticism. It is constructive. Remember, we are learning. We are in the process of learning. This is a training part. Don't take it personal at all. See, one of the things that I have, even though if I know stuff, I pretend that I don't know it when I'm in our workplace. Because if I said that I know it, and then they ask me to do it and I don't do it well, they're going to say, oh, wait a minute. You told me that you knew how to do it. Actually, you don't even know. Now I look really bad. So I better go kind of low profile. I'm just going to learn how you do it here so I can adapt myself because I have ways of doing my stuff. So then I see how they do it. I'm going to add what I know and what they have and try to kind of, mimic what they do so I can fit in. I'm not gonna go there. Oh, yeah. I know how to do this way and that way. No, that doesn't work that way. They think that you are arrogant, that you think that you know too much. Remember, we just being trained. Be humble. Even though if inside of you, you are calling them every single name possible, that's what I do. Someone kind of scream at me, call me this, and oh, you, not doing things right. Let me show you how you have to do it. I take it easy. I know inside me I'm fired, but I pretend that I'm not. See, you have to become an actor. And then you don't suffer. You see, I take things really in a very relaxed way. I don't take anything personal. I learned my lesson. I used to be like, oh my God, somebody said something. I was like, oh, you know what? Show your job up, you know what? And if I have to move from job to job, I didn't care. I said, oh, no, listen, you're not going to come here and treat me like I'm your kid. Well, unfortunately, that doesn't work because everywhere that you go, you're going to have someone who's going to do or who's wanting to do that to you. And you are weak enough to fall into their trap because that's what they want. Think about these people when you're doing the internship or externship, or you just got a new job, people feel threatened. People that are in your level and they've been working before, they think, oh, what did I receive this new person right here? Are they gonna fire me? Something is going on. They try to make your life miserable. They start putting tricks on you and you fall. Simple. You just fall right there for whatever they do. No, I learned my lesson and I said, oh, no, you're not gonna get me. I'm here to work, and if you tell me that this is what I have to do, I'm gonna do it. And I'm gonna be very nice to you. Because if I show a little attitude with them, it's over. So again, do not get these things personal. Take the initiative. Be a team player. See, sometimes we talk about, oh, if we have an interview, I'm a team player. What's a team player for you? When I play them, not when they play me, right? No, we have to work as a part of the team. Initiative means that, you don't have to be asked every single time to do something. Alberto, can you do this? Alberto, can you do? No, I have to have initiative. I already know that this is my job. I know that if I finish this, I'm going to start doing something else because there is always something else to do. I'm not saying that I'm going to run to do things and to finish right away and then it starts. No, that's not what I'm talking about. I'm going to take my time doing whatever I have to do and I do it right. And then I'm not going to be standing, sitting, or using my phone when other people are looking at you and other people is needing you. There are things to do. I ask. This is me, and this is what I want you to do. Remember, you're learning and your first time in your job, you have to do the best that you can so you they get to know one phase, which is you are the person that I want. After that, it is up to you if you want to change, which you shouldn't, but things happens. But if you want to hold a job, you have to be like that. Not taking anything personal. Be humble. Don't say that you know things. I learned this and I'm willing to improve that, to get better. I need more practice. I know you're doing it so well. I'm seeing you working with the patients. Oh my God, I want to become like you. You tell people like that, people who works with you, even though if it is not what you're thinking. Remember, you're going to become an actor. So you're not gonna go to Hollywood, you're gonna go to Bollywood, okay? So careful. So that's what you have to do. People, if you don't know how to manage people, then they're gonna eat you alive. So don't just sit, particularly when you're doing your internship where you knew, oh, I just finished what they asked me to do, so I'm just gonna chill until they tell me to do. You're not good. You're not good, because if I don't tell you to do something, you're not gonna do anything. No, there's always something to do. Ask the office manager, ask the doctor, ask the nurse, whoever is in charge, ask your coworkers. Hey, what are you gonna do next? If you're gonna draw blood, let me know, okay? I wanna go learn. I wanna see how you do it. You're gonna do an EKG? Let me know. Oh, by the way, can you show me how this machine works? How this works? How that works? Where do you find these? That's the supplies. Where are the needles? Where are the tubes? Where is the paper for the EKG machine? There are so many things that you're gonna be learning. Because one day someone is gonna ask you, oh, can you get me a case of gloves or a box of gloves? And you're like going around and rolling your eyes, thinking, oh, what do you mean? How do I know that? No, we have to know where things are. Get familiar with the storage room where they have all the stuff. That is the purpose of being American. Always wander around, looking, checking, removing things that aren't, causing a hazard to someone, something that is not in the right place, something that might be falling, something might be taking the risk of breaking. That is taking initiative. See, it says right there, treat the externship or internship as if it were the probationary period for a new job. I take it as if it is my new job. And yes, it said probationary because it's the time that if you don't do it well, they're gonna get you out. So you really, really, really have to, and not only that, you're learning. Listen, that's the best opportunity that we have to have an internship so we can learn so much from. Because now I didn't have no experience in the medical whatsoever. Now with the internship, I'm interacting with the real patients. I'm doing EKG with the real patients. I'm drawing blood. I'm getting to know these tubes, the needles, everything else. I'm learning so much that I'm going to feel very confident when I apply for a new job. Remember, this is the first chance that you have to kind of train yourself and learn as much as you can. So you have to be open, learning, absorbing. You're going to be a sponge, learning new techniques. Maybe you have a thing. I have a technique for those who took phlebotomy with me, EKG. And some of you did phlebotomy with me. So I have a technique. Well, if you feel like some of that technique can be adjustable to you, well, use it. And then you put a little bit of yours. Remember, a combination of things, getting from here, a little bit from there. So you're going to create your own technique. As long as you follow all the steps, that's all it matters. That you're going to do the things right. But something that is going to be a lot easier for you to do it. Because remember, in the classroom, we learn a lot of stuff. Theory. But when we go hands-on, oh, that's a different deal. And now when you move into deal with the real patients, it's totally different. And that's what I'm talking to you like this, as if we were in the classroom, but at the same time doing the internship or doing your job, because you're dealing with the real people. This is not doing this for a grade or anything like that. No, this is now to get paid. So that's basically what it is. Now this is to have a steady job. That's what we need. General rules. Now, remember that you're going to be sent to those sites. Oh, before we move to that, I almost forget. The other thing that you can do, remember that I told you before, after the break, when we return to this class, I said, okay, so you're going to go to that internship. That is a site that the school is providing to you. But you also can find your own site. So let's say that your doctor in your neighborhood, where you is your medical doctor or the medical of your kids, or your mom or your husband or any doctor that you visit over there. Talk to them. Tell them that you are going through the medical assistant, you're taking the medical assistant program. That you will be, that you're wondering if, they will be willing to take you there to do the internship. And, tell them what availability you have. At the time that you will be finishing, things change, right? But for the time being, you gotta be kind of building up. It's like building up experience. You go in there and you can talk to few people in your area. Be nice, well-dressed. It doesn't have to be something out of, this world. No, you just go simple but well-groomed and things like that, because they're going to see you and they're going to say, oh, wait a minute. This person can be an asset to my office. I'm going to have this person for quite some time and I don't have to pay them, but they gain in experience. So this is 50-50 benefits. So that's another way that you can do it. If you know someone, you talk to this person, tell them that you are doing the medical assistant program, if they will be willing to give you the chance, the opportunity to do the internship over there, because you live in the area. If that is the case, you have to bring the business card from this person or the person that you spoke to and give it to the director, give it to the placement person, coordinator at the school, or if you encounter me first, you can give it to me and I give it to them. And we will contact that person, that doctor, whoever office is, and we will send some paperwork. If they're willing to accept you over there, well, we will give you some paperwork and they will be training you. So that is another way that you can do it. So again, the school is going to provide you one, but if you don't have if you have someone that you can probably do your internship, well, take advantage. So that's what I was going to say before. So I almost kind of turned the page and forget that. But when I saw the word site right there, I said, oh, wait a minute. There was something that I need to say. So that's basically what it is. So there are many rules. Remember, this is like the rule for going to work. So you're going to be assigned something to do, and you're going to be able to accomplish those. So this is like when you're going to get a new job. Remember, I've been saying that. Ask exactly what is it that this office does. See, particularly when you're going to have the interview. I said, okay, so this office what is the specialty in this office? Oh, this is a general practice, general medicine. Oh, this is a family practice. Oh, this is a pediatric specialty. So those things, most of the places that you're going to go, usually they're going to be like general doctors. So these family practice doctors. So when we said general family practice, that means that they see little kids and elderly patients, anyone from little kids to elderly. So you're going to be exposed to a lot of things. So we ask questions. So we need to know what is it that we're going to be doing and where we're going to be doing our internship. The same as when you are going to start working. Fortunately, this is just the internship. So you can do the internship as long as you learn the things that you're going to do. You're not going to remain there forever. So after your hours are done, that's it. You receive your hours and now you move to the next level. So you always ask what exactly they do over there. Remember, ask questions, ask questions, ask questions. Have a notepad. Have a little something when you're going to record notes. So you don't have to be asking every single time. So we always have a little notepad and, pen and write down things. Because at the beginning, nothing is easy. So then you're going to start, because it becomes really annoying that you're asking the same things over and over and over. Then you're not retaining information. And because we have so many things in our heads, particularly when we are nervous, well, we're going to forget. So have a notepad and then write the stuff. If they explain you something, if they told you something about something, learn it, write it down, keep it with you. And if this happens again, you just pull out your note and review it. So that's basically what it is. Never do something that you're not sure about it. And you just didn't want to ask. You feel like, oh, well, if I ask, they're going to think that I'm not good. Listen, you're learning. You're in the process of learning. So the internship, you need to ask. Because if you do it wrong, then you're going to be in trouble. Because you didn't ask. I'd rather someone to get upset at me because I'm asking questions, not because I omit to ask. Because if something happens, that's, I'm very sorry, but I always ask questions, I want to make sure that I'm doing the right thing. So before they turn around and give you a look, you tell them. Now, if I'm asking the same things over and over, then it becomes a problem. So I'm going to tell you probably once, maybe twice, but after that, you need to recall those things, or once again, document it, write it down, because otherwise, because sometimes people are busy. People are not in a good mood all the time. People don't like to train. Think about you. You're working in a place, they bring someone new, and this person is asking you questions all the time. Think about how you react. Well, it's the same way that the other person is reacting now because the tables have turned. See? So we have to understand, being empathetic. Because now now I'm in the position of this person. Said right there, stay busy and active performing meaningful tasks. I already told you, see? Don't just hang in there, sit somewhere, or go to the bathroom, hide yourself, pretend that you're doing something and walking back and forth, up and down the hallways. No, because someone is watching you. Believe me, somebody's watching you. Remember, you are a threat to many people in the workplace because they think that you're going to replace them. So as soon as they see that you're not doing what you're supposed to, they're going to bring it in. So this is reality. See? Ask for additional duties if assigned duties are completed. See? I'm telling you, this is how it happens. So don't just hang somewhere or hide somewhere, because people are checking on you. But if you look like you have initiative, that you are on top of everything, and it should be that way because we are in the process of learning. I want to learn as much as possible because it depends of all the things that I'm practicing right here in this opportunity that I have in this internship. I'm going to do very well on my job. When I get my job, I already know a lot of stuff. So I learn in the school, I learn in my internship, I'm ready to get a job. Show responsibility and dependability. Well, you know what those means. Responsibility means, that you do the things that you've been assigned and you do it right. That you go a little beyond. You go the extra mile. Dependability means that you are coming on time. That I gave you this task completed in this particular time and you did it. Not only is responsible, but I can depend on you. I can count on you. So sometimes it looks like these works are kind of overlapping meaning, but they do somehow. So we like to, that make people believe that, we are essential, that they need us. See, when you depend on someone, the person needs that someone. So that's what we're going to do. We're going to make them depend of us, that we are a need, that they must keep us. And how are we going to get that? Well, being responsible, doing the task that we were assigned, going the extra mile, helping others. Oh, I already finished with this. Do you want me to help you with something else? Sure. Remember, you're learning. The more you do, the more you learn. It's not, I don't want you to take this internship as something that it is an obligation, like it is a punishment for you, that it is, I just need to get those hours. It doesn't matter if I'm going to be hiding in the bathroom half of the day or the time or the shift that you have. No, that's not, because you're not benefiting from anything. The only person that you're fooling is yourself. You're not fooling anyone else because you're not learning. You're not taking advantage of this opportunity, because this is an opportunity. It's not the same coming out from the school and sending you to look for a job. Even though after the internship that you have learned so many things, you're going to be feeling still not comfortable enough. But you will get the confidence because eventually you can get a job and then you're going to practice all those things. And you're no longer going to have someone on your back telling you what to do all the time, because you learn what to do, you know what to do. So that is the best part of it. So the reason what I'm telling you this is because I hear people saying all the time in every school, students are always, I have to do that internship and that's free. And, I'm working for them. And then what am I getting? And well, you're getting a lot. You're getting your hours so you can complete your program. That is number one. Number two, you're getting prepared, you're getting trained. So now you can move and take a job and keep it. So it is important. So we don't see it as, oh my God, I just giving my time to these people, but they're not even paying me for it. No, you are paying already for it because you're paying for the school, and this is part of it. So just take it as part of your classes, as part of, the things that you need to prepare you for that job that you're definitely gonna get, because you're gonna feel very comfortable doing it. and you're gonna be hungry for that job after you learn. If that's what you really want, remember, you have to like it. You have to like, not just because they're gonna pay you, just because you're gonna get some, money in return, but it's because you also gonna enjoy what you're gonna be doing. Me, I enjoyed this. I wouldn't choose anything else that's not related to the medical. Nothing. Never looked back and I said, what if I have become this or that? No, I never have in my mind anything. I wanted to be a doctor, I believe, from day one. And that was all I wanted in my life. And I did it. Now I'm teaching, but this is related because I want kind of easy going for me, because I'm not gonna kill myself for working for what? Whatever I was going to get, I guess I get it. So now just take it easy. And you see all the knowledge that I gained with all these jobs in my profession and all these people that I interact in, all these places that I went to, it helps me, it have helped me a lot, see, to teach. I never thought that I was going to teach, but but I do enjoy it because it's related to what I know. This is not something that it has nothing to do. No, this is what I learned. It's just that I'm applying it in a different way. Not directly with my patients, are now with the students, so teaching them what they are supposed to do at the workplace, learning the right, the right thing to do. So that's basically what it is. Any questions? Okay, things that you should never do in your workplace. So there is something that is called confidentiality. This is gonna haunt you for the rest of your life. Confidentiality. The patient's information, everything that the patient tells you, you should not tell anyone that's not taking care of the patient. So you and I, we're working together. You're a medical assistant. You want me to assist you with the patient, and you are going to tell me what the patient problems are. That is okay. You tell the doctor what the patient told you, blah, blah, blah. We are working together. What I'm trying to tell you is, if you and I, we work in the same place, I assist the doctor doing a procedure, and then I saw certain things over there from the patient and come and tell you, oh, when I was inside that room, I saw this, and blah, blah, blah. Talking about the patient with you, that at that moment you have nothing to do with the procedure. It's the doctor that and besides, what I'm talking about is personal issues from the patient. So it should not be making any comments, anything at all. Remember, confidentiality means that information that they give it to you, you're not gonna release it to anyone that's not involved with the treatment of this patient in a professional way. You cannot bring this information to your family, to your friends outside. That is confidentiality. Patients' information are very, very sensitive. So we should not, this is like a confession. This is like going to your priest and you are confessing your sins. If you know that the priest is going to spread all your sins, everybody's wondering what is the purpose of you going there? No, but it's because you trust this person, because it is confidentiality. You confide in this information. So very important. We're going to be talking about this all the time, confidentiality. We're going to go to a chapter that, well, we're going to talk about patients, communication. We're going to talk about medical records. We're going to talk about insurance. We're going to talk about so many things. EKG, phlebotomy, every single aspect. We're going to talk about confidentiality. So that's basically what it is. Just because it's a family member, you don't have to tell them the diagnosis or what was said during the interview, during the examination. No, that's not our job. It's not the doctor's job either. The doctor is not going to tell the family this and that from the patient. No. There are certain things that we, for the need of the situation, we can tell the family member that is in charge or something like that, or if it is a minor. But certain things. So we got to keep all the information from our patients confidential. Now, do not get involved in personal relationships in your workplace. This is the worst that can happen to you. I'm telling you, a couple of my friends, and I'm talking about someone who has a very, very good job, very good position, making very good money, got involved, someone in there, next thing you know, the relationship went a little sour, and that's it. That was it. That was the trigger. Then rumors start, filtering, gossiping around. Next thing you know, someone lost their job. So you don't want to get involved with someone in the workplace, believe me. Having this person where you work, no. And then go and living with this person and you have it at home, you have it at work. Oh my gosh, that at the beginning probably is very nice. But as the time goes by, enough is enough. So it's better to have distance. Distance yourself from people. It's better to do that because believe me, probably you are the one who's going to be losing. So don't get involved. Use any drug samples without express permission. Now, I hate the word drugs. You can imagine how much I hate it. I use any drug. Immediately you think about cocaine, marijuana, crack, ecstasy. You think about all these illegal drugs. So I don't like to use that word at all. What drugs are you taking? Seriously? What medications are you taking? So let's say medication samples. I don't know if you're familiar with this, but medical offices, hospitals, we receive samples from these pharmaceutical companies. So we have pharmaceutical representatives coming over our office. And they bring samples of the medications that they want us to promote, to prescribe to our patients. I went through that for 14 years, so I know what I'm talking about. And I was a medical assistant, and I know what I'm talking about when I saw these medications there. So these medications are for the use of the patients. So when the patient goes there, and we try, this is a new medication, or it's a new pharmaceutical rep that comes from representing a different pharmaceutical company. They bring medications and they give samples, but the doctor is the only one that can deal with those samples. You get fired on the spot if you're being caught stealing these medications or giving these medications to someone else. I've seen it. Get fired for nothing. So these samples are not for you to decide what's going to happen. These are the doctors. Now, if you're taking one of these medications, or if a family member is taking these medications and you want these medications, you have to ask the doctor who is in charge. Doctor, Do you think that I can take this or that? I take this medication. I don't have, my insurance doesn't pay for it, or it is very expensive. And I have to pay from my pocket, or my copayment for this medication is too high. But you have to talk to them. Don't think that because they are there, because they leave these medications at front or they bring it to the back, they are for the public use. No. So very careful with that. The doctors decide what to do with those medications. They give it to the patients, particularly to those patients who are taking other medications and those medications do not work. Well, we're going to try this and see if this one works for you. But those are samples that we give the patients. We don't sell them either. So we have to be very, very careful with that. Oh my goodness. Remember that we talk about financials. What is it that the collections that you're going to be involved? Well, you might be receiving money from copayments, patient that pays cash for the visit. So here comes the next one. Never borrow from petty cash. See, the petty cash is this amount of money that every day an office takes out that belongs to the office. So we take some money so we can give change to people who brings bills that are larger. So we don't have to go outside and change the bill. So usually we get like $100. So that $100 are going to be in a box. And every time that we need to change, then we remove from that money and then we put the money back. If we need to buy something small, something that we needed immediately, oh, you were needing some pens, you didn't have no pens. Oh, you can go to the store and get them and bring the receipt. And then with the receipt, you put it right there and you balance it out. Here it is. Because at the end of the day, you have to balance that. And the $100 that I put here, $100 I need to have at the end of the day. So this is money aside from what the patients pay, of course, because this is money that is being assigned for change and to buy small things that are needed. And you have to bring the receipt and leave it there. So whenever you're going to balance the money that is not there anymore, well, you're going to be replacing it with the receipt that, you know, it is for the amount of money. You're going to balance it out. So be careful with that. Some people take money from there for the breakfast, for lunch, and they said, oh, no, I'm going to pay when I get my pay. No, because at the end of the day, that money needs to be balanced. A lot of people get fired. I fired 3 people for that. They didn't just borrow. It's just that they put borrow just because they want to be nice. It's don't steal money, because that's stealing. Medical assistants stealing the money from the copayments, from the patient that pay cash. So they got fake receipts saying that they purchased this, but they never purchased anything. So they got caught. Because remember, people's watching, people seeing what's going on, and they come and tell us. Someone is going to open their mouth. Someone someday is not going to like something. It's not going to get along with you. It's going to have a fight with you, and it's going to turn you in. So believe me. Never expect the physician to treat family or friends. Here is another one. Well, when we work in a place, happens a lot. Well, my family is welcome because I'm a physician, so I can see them, right? But when we are medical assistants, when we are nurses, when we work and we're not doctors, and we are not the owners of the office, we cannot do that. So what is it that you cannot do? Well, it's not healthy for you or your family that your family member comes to the same office when you work. That is not healthy. This is like having a relationship with someone, one of your coworkers. It's not good. Doesn't work. Believe me, it works for a little while, but eventually it's gonna fall apart. Or friends. You know why? Because your friend and your family member, when they come into the office, they want to put them first. You want them to be seen first, regardless of how many people is in the waiting area. So that's not good. That's going to create bad image for the office. The first thing that you do is you bring them in and they come to you and then hi, and hug and kiss and hi, mommy, hi, papi, hi, friend, hi, blah, 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 blah. So the patients that are there in the waiting area, waiting for half an hour, 2 hours, 3 hours, and they see these people coming in at the last minute and you put them in right away. And it says, hey, I've been waiting here for so long. What's going on with these ones? Believe me, seen it, been there. I fire people for that too. Not to mention, when you order tests, you're going to tell them the results because you know the results. You're going to receive the results. Remember, you're going to receive this correspondence and you're going to have the results right there. So now you're going to be telling them, oh, what was my results on my blood? Oh, listen, I can give you a copy. And you even take a copy, illegal. You're not supposed to be telling them anything. More or less, give them the copy of the results. Remember, you're not a medical doctor. You can put your family in danger. You put yourself in trouble. And your friends. Let me tell you what happened to one of, I believe, I'm not pretty sure if it was a medical assistant or it was the nurse, someone. Anyways, this was the case. A friend of this nurse, of this person that was working there, her friend was seeing the doctors there. Was her friend. So one day, her friend went over there and she got a pregnancy test. I'm telling you stories that are real. This is not something that I made up. These are real situations that you can understand why family members and friends should not be seeing the doctors in the same place where you work. Because that's going to bring lots of troubles to you. So this friend came over and says, hey, I need a pregnancy test. Sure. She didn't even see the doctor. This person went over there, gave her the cup to collect the urine, went and did the test, and told the results. Because these are instant tests, the pregnancy test. It looks like it's something so simple, like, well, anybody can do it, right? But it's very serious when it comes to the patients and the results. This is not your friend at your home. This is not you at your home either. This is in a medical place. So what happened? This person told the other one, oh, no worries, you're not pregnant. Now, how does she know she's not pregnant? Just because the kid is not marking the two little lines right there and saying, okay, so you're not? No, probably the kit that you used was not good. Maybe you didn't do the right test. You didn't collect the right urine because it has a urine that is special for pregnancy tests. So anyways, to make the story short, this person, a couple of weeks later, she went on a cruise. She got wasted, she drank, she vomited her guts. Next thing she knew, she went to the bathroom, she came back, she was very sick. She went to the bathroom and she saw a clot of blood right there on the toilet. ball. She had the impression that something was weird. She took that and she took it to the emergency. Guess what? She had a miscarriage. She actually was pregnant. Her friend told her otherwise. You're not a doctor, so you don't know. And just because the test that I do from the urine is not positive does not imply that you might not be pregnant. There is another test that we're going to do, which is blood. And the doctor has to evaluate. You have to ask your questions. You didn't ask anything. You just ask, okay, no problem. I give it to you. So what happened? She sued the clinic because she said, oh no. When she went to the emergency, well, I saw the history. I saw everything because I was working in that place and I know the lawsuit that they have for that. So they said, oh, wait a minute. What do you mean you were pregnant? Yeah. I went to the emergency because I was having a vaginal bleeding and, I got this big clot and I took it over there and they said, I was pregnant. And I came here for a pregnancy testing. You guys told me that, that I wasn't pregnant and they sued the office. And who was the first one who, was crucified? Her friend. There is no friends, people. When something like this happens, when a problem rises, when you are in a bad situation, when you need money, when you don't have a job, nobody's next to you. Everybody turns their backs on you. Well, this was not different. She lost her job. She has a lot of problems. She can no longer work in the medical field, lost her license. I mean, they got sued. Come on, what else do you want? And that was a friend. See? So it's better to stay away with all these people. We are better off that way. Never ask a prescription to a physician. You're not their patients. Another thing, never choose your employer as your medical doctor. Oh, that's like having family over there. Don't have someone else's away from the office because everybody's gonna know what you've been diagnosed with. Everybody have access to your information. You don't want that. The same your family. Your coworkers are gonna know what your family problems are, what your friends' issues are. So everybody's gonna know about you, your family. You don't want that. I don't want any of these issues. So you ask for a prescription to the doctor that is following you, with the doctor that you sign up, which is your primary care physician. You don't ask a different doctor. That's a no-no. First of all, that's going to be a little embarrassing because the doctor is going to tell you no. Then you're going to get upset because, oh my God, I work for you. How's that you cannot, prescribe me? You're a doctor. Now you're not a good doctor. So be careful. All those things we need to avoid. Believe me, they look, they sound kind of not important, like harmless, but they are not. They are very, very complex. So be careful with that. Any questions about what you shouldn't be doing? Okay. Continuing education. Well, when we said continuing education, that's not imply that you're going to go to a different major, that you're going to become a nurse now. That's not continuing education. Continuing education in your own field, in your own profession. You have to be up to date. Things are changing, things are evolving, so you got to move with the flow. If medical records, electronic medical records are the trend, you have to learn how to use these applications for medical records. There is new vaccines for these medical conditions. I need to be familiar with the new vaccines because when a patient comes over and asks me, hey, do you have the COVID vaccine right here? No, I don't know. Because they expect that you know everything when you're working over there. You don't need to know everything. But at least this very basic stuff, we need to know. We need to be on top of everything, every single changes in your level. You need to know. See, when you graduate from this program and you take the national certification, one of the things that you have to do before you renew your next time your certificate, you have to take some continuing education credits so you can renew your certificate. Those continuing education credits, most of them, they are 90% are free. You get it directly with the same organization that is giving you the certificate. But you can do it online. You can do anything. So you can go continuing education credits off. And they said medical assistants. Oh, study that. Complete those, read the material, and complete the little quizzes that they give you at the end. You print it out and you send it to the organization that you're gonna be, taking the credits. Or the organization give you that information. It is in the webpage right there in their organization portal. And when you register, you can have access to all those. And every year you have to complete, every 2 years, you have to complete certain amount of credits, certain amount of continuing education credits. So that's part of the process, the requirement before you register, you renew your certificate. It's not like you're gonna go renew your certificate. Oh, I'm gonna pay now. No, you'll not be able to pay until you take these continuing education credits. So it's easy because you cannot just read material and then take a little quiz. And you can go back and forth and read it. And if you didn't do well the first time, read it again and answer the questions. It's not a test. So there are quizzes, but you can take it as many times as you want until you pass. And for each quiz, you're gonna get certain amount of credits, usually 1 or 2 credits. And if they ask you that you have to have 10 credits, you're gonna have it. So in 2 years, how's not, I can get it in half an hour. But let's say that you want to do once in a while, do this, and then accumulate them. And when the time's right, then you have to present those credits, you do it. Or you do it directly in the portal, and you're earning those credits, and those credits are there. They're not going to disappear. As soon as you complete the quizzes, they are registered right there in your portal, in your account. So when it's time for you to renew, you just go there and pay. That's it. You don't have to do the credit because you already complete them. So this continuing education materials very important for you because it keep you up to date. A lot of things are changing, and we don't know what's changing if you don't read about it. So again, this is what I already told you, how you're gonna get these credits. You're gonna read some material and be quizzed from it. You can attend, seminars, you can attend symposiums, whatever the case may be. But then you have to go somewhere and listen to a lecture, blah, 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 blah. And you can take it, from the piece of your home and your computer, your cellular phone, you can do it just from there. You don't need to go there. But these are different ways that you can earn these credits, whether attending, all these different events where you can earn those credits, because these events that you go must stay there, that you're gonna earn some CEU credits. So other than that, and then you present them at the end when you have to register for the exam. So that's basically what it is. So it's not complicated. Believe me, it's simple. It's just done. We have to do it in advance. We don't wait for the last minute when our certification or certificate is going to expire. Remember, we have 2 years. And in 2 years, if you have to take 10 credits, well, you have to read 5 materials. And then you get it. Easy. Sometimes if you work in your hospital and if they have meetings and all the stuff and said, okay, you're gonna earn some CEU credits, and then you go there and then they give you paper that you attend this particular seminar, this particular meeting, this particular symposium, and then they're gonna give you the credits and then you're gonna submit them. Just for attending something, listening to a conversation, someone. So you don't have to read anything, you don't have to take a test, you just present the certificate that you were giving for the attendance to this particular, events. That's how it works. Professional organizations. So once again, the same way that, that we learn from these seminars, from these from these lectures, or from the internet, we can also learn from these organizations where we work. Because every organization might be doing something different. As a medical assistant, we can be in a variety of fields within the medical field, or specialties, if you will. So from each one of them, you're going to be learning something different. So you're going to be having all this variety of training, because every single time that you do something, you've been training yourself. So that's basically what it is. So these places where you go, starting with your school, they prepare you so you can reach your goals. So that's basically what it is. So it's all the knowledge that you're gaining from day one, from the moment that you enter the school and you do your internship in the organizations, that you take your exams, that certifies you, because they have lots of information there. They have articles about every single condition, every single office, how this works, how the phlebotomist should be acting, how the phlebotomist should be performing, how the EKG technician should be doing this, how you should be talking to the patient, all that information. So lots of information that is gonna make your profession, your knowledge, so it's gonna make you marketable. So you're gonna be having all this knowledge that you're gonna go somewhere else, and you gain lots of information, lots of training, because that's the purpose of these CEU, so it's continuing education units. Let's talk about these organizations that accredit the schools, the institutions. So the American Associations of Medical Assistants, this is an organization that, accredits these schools, or accredit these certificates that they offer through these schools. So that's basically what it is. So you do have an organization that represents you. There is an organization that represents nurses. There is an organization that represents doctors, and so on and so forth. So this profession is not an exception to the rule. So that's basically what it is. So this, particularly the American Associations for Medical Assistants, or AAMA, this offers the certification for medical assistants, and it's called CMA, Certified Medical Assistant. So again, you can be certified in a couple of ways, maybe more than two. One, you go to an institution that offers the program. That can qualify you to sit for the national certification. through this organization or the organization that we're going to talk about next. So that's basically what it is. Now you can be certified if you work for a medical doctor and they train you over there. Now, what is the problem that working with a medical doctor is going to cause you to pass the exam? Because the medical doctor is going to train you hands-on how to draw blood, how to do the vital signs, but it's not going to be telling you all these intricacies, everything that compounds a medical assistant. They're not going to talk about law and ethics. They're not going to talk about HIPAA. They're not going to talk about OSHA. They're not going to talk about any of these, or the things that you have to do. They're not going to talk about anatomy and physiology, medical terminology. No, they're just going to teach you, okay, do this, like monkey see, monkey do. It's just hands-on. So when you're going to take the test, it's not about doing this, because they're not going to test you practical. They're not going to do a practical test. It's going to be theoretical. Everything is theory. So if you don't know all these other parts of the medical system, you're not going to pass. But yes, if you feel confident enough, you qualify to take an exam with the national certification, and you have to bring a letter from your workplace stating that you've been working for them as a medical assistant, that they train you there for this period of time. It has to be more than 3 years, 3 or 5 years, something like that. So that's the way that you can be certified. Because you don't have that experience, then you come to the school. But once again, the school gives you a broader spectrum, subjects, knowledge. Because you don't just need to be trained hands-on these particular practice skills. You need to know a little more than that. Now, these organizations can offer certifications yearly or every 2 years. The one that we use is 2 years. This is 1 year. This American Association of Medical Assistants, your certificate will expire in 1 year. Whereas the one that we offered, which is going to be the last one, is going to last 2 years. This is another one, the American Medical Technologies. I got this one when I went to the school. Every year I have to pay, and I have to renew the certificate. So that's how it works. Now, do not worry about when these organizations that provide certificates for the medical assistants, when they were created, where they are located. Who cares about all that? Nothing. It's just for you to know there are different organizations that can provide you with exam so you can be certified. Many of the schools, they choose one of these organizations. Our school have this one, the National Healthcare Association. And it had different testing methods, not testing method, different professions that they offer, not just for the medical assistant. They offer the certificates for the administrative part, only the administration if you want. As a clinical medical assistant, only the clinical. If you want to be a biller and coder specialist, they have that. If you want to be a certified medical transcriptionist, they're going to have just for that. So you're just going for that program. So that's basically what it is. One of the things that I like about these certificates that last 2 years. So you don't have to be renewing this every year and paying every year, because you have to pay and you have to take those credits. Remember those CEU credits? Those continuing education units, you have to take it. So it's better to take it every 2 years than every year. I hope that it will be longer than that, but that's as far as, they can go. So that's basically what it is. When you're ready for this, the school is going to help you with this. Probably I'm going to be helping you with this. Helping you how to register, because you're going to be registered in the school and you're going to be taking the exam in the school. Everything is going to be in the school. It's a computerized test. So whenever you're ready, whenever you complete all these course, work, including the internship, then you qualify now to take the national certification. So that's basically what it is. Now, this offers technician like phlebotomy, EKG individually. So you can take almost anything, whatever you want. They have that possibility. Now it says differences between CMAs and RMAs, no difference. Certified medical assistant, registered medical assistant means the same. It's just that there's a different organization that is providing these certificates. Let's say that you want to go to Bellevue Hospital or you go to Mount Sinai Hospital. There's hospitals, period. It's just the name change. That's it. So these are two different. And then we have the other one, the NHA, the National Healthcare Association. Remember that that's the one that we use for our students. So no worries about this. This is just to let you know that there are different organizations that provides you for the certificate after you graduate. Now, remember, you're going to have two certificates, at least. One from the school, certification of completion as a medical assistant, because you completed this program. You did the theoretical part, you did the internship, you pass all the exams, you graduate, you have a certificate of completion. Professor Hoyer, can I work with that certification of completion? Yes, you can. But only medical offices will accept you with the certificate of completion. If you apply for a hospital, they want you to have national certification. If you are not certified nationally, you will not get a job in a hospital. So that's something that is really important, because certificates are voluntarily. Licenses are mandatory. What it means by mandatory or voluntary? Well, certificates are voluntary. If you want to take the national certification, it's up to you. Because remember, you can still get a job in a medical doctor's office with the certificate that the school give you after completing this program. Now, you want to work in a hospital? No, you have to have a national certificate. So it is you have an option. That's what it's called voluntary. Now, what happened to licensed people? Well, someone who's licensed, let's say a nurse, medical doctor. You did all the program. You ran 4 years, 7 years doing, regardless whether it's a nurse or medical doctor. You pass everything, all your exams. Now you completed. The university is going to give you a certificate that you graduate as a medical doctor. But if you don't pass the boards or the national certificate, the state boards, then you're not a doctor. You cannot practice. You cannot practice anything at all. You cannot even be a medical assistant. See the difference between licenses and certified? Licenses are mandatory. You went to the school for nursing school, you pass all your exams, you completed the program, you have a certificate that you complete the nursing. Now you have to take the state board, and you don't pass, you're not a nurse. Until you don't pass, you will never get a job as a nurse. You will never get a job as a doctor. Medical assistants, yes, you can get a job. It's just that you're not going to get a job in a hospital, but you can get a job. Well, if I study as a doctor and I don't pass the boards, or I don't want to take that board because it's very difficult, then I'm going to work in a doctor's office. Hey, listen, hire me, and I'm going to be a doctor there. But it doesn't happen that way. I have to have, because states licensings are state-wise. Certificates are national-wise or nationwide. So that's basically. So we talk about this. So the requirements are the same. You have to be graduated from the program. You have to have a high school diploma, and you have to pay a certain amount of money. That's it. The difference is how often you have to be recertified. So RMAs, CMAs needs to be recertified every 2 years, every year. So that's basically what it is. Remember, when you finish, you have to register, you have to create an account with whichever organization you're going to be taking tests. You have to pay a fee for that. And then they're going to give you the day that you're going to take the tests. You choose the day, you schedule it, that's scheduling an appointment, and then you go take the tests. And if you pass, they're going to send you a certificate. That's it. That's what they're telling you right here. Any questions about certificates? We're going to have plenty of time for some of you to discuss that. And any questions that you have about that, I can answer because I do know how this works. So basically, that's what it is. So the summary is just telling you what medical assistants do. Remember, what is the medical profession? We already talked about that. So you're going to be able to learn the ins and outs, the front and the back. Remember, front means the administrative part, the back means the clinicals. This is how they ask in exams. So medical assistant has two parts, front and back. What is that? Oh, the administrative and the clinical. That's it. You're going to learn a variety of things. So that's why we want to hire you, because you know more than one thing. I'm not going to hire a phlebotomist, an EKG, someone who do vital signs, someone who answers the phones. No. What I'm going to do all that, pay a salary to different people when I can have one person who does everything. So that's why medical assistants are, in demand. But it all depends on you if you want to keep your job. So you have to do the things right. So that's basically what is important right here. Is, the classrooms, the internship, and you're ready. And if you want to go a little beyond that, take the national exam. Remember that national certification is voluntary. It is not something that you must take. Or you take and you didn't pass, no worries, you can retake it as many times as you want, but you have to pay every single time that you fail. Right now it's $130 for, it's $180 for medical assistants, $130 for phlebotomists. So if you fail the test, then you have to take all over again. And you can take it several times. Just that you gotta make sure, right, that you know how many times are you allowed to get it, and how often you can retake that exam. But anything else, no. So that's basically what it is. All this, training that you receive is with that purpose. To get you, to get your foot into the work, environment.